Hello everyone, my name is Brittany DeBoard, and thank you for joining me for this discussion of what makes a good interprofessional service member for public health. I would like to first start off by describing the nature of my project, which involved growing a personal garden while cultivating your mental health. Due to the current state of our society in response to the COVID-19 pandemic, I find it now more than ever important that individuals have the knowledge and skills they need to grow healthy vegetables for themselves. The actions taken to grow a garden are closely related to ways one can cultivate their mental health, such as getting sunshine and participating in activity and exercise. Mental health during this time is also an important aspect of health that for many have been negatively affected right now. My project involved the blueprints to grow a successful and efficient personal garden with limited space to promote healthy eating, as well as incorporating beneficial aspects related to improving one's mental health. Through this experience, I worked with 3 experienced professionals in the agricultural and mental health fields. In response to what makes a good interprofessional service member for public health, I would say there are 3 skills that one must possess to make a good service member, which includes someone who is knowledgeable but is still willing to learn, receptive to others' needs, and can effectively communicate. Being professionals of public health does not stop within the confines of public health. To effectively help your target population, that can and will require you to reach outside your public health realm of knowledge to all facets of life. A member who is knowledgeable in public health is key, but you also must be willing to learn to continue in a field that is always changing with new innovations and studies that are constantly taking place and being published. Your team members will look to you for answers related to public health and trust that you will have them. Being willing to find answers and ask questions to help your target audience, as well as being knowledgeable in public health aspects, is key for success as an interprofessional service member in public health. The next skill is being receptive to others' needs, which involves using concepts of public health, such as effectively using the proceed-precede model to determine at which stage an individual is currently at so you can help move them to the next stage and one step closer to their goal. Or understanding that a particular individual wants to stop smoking but lives with another smoker. How can you help to break down that perceived barrier in order to increase that individual's chances of stopping smoking? There are countless concepts, theories, and models in public health that can be used to help anticipate the needs of others. In my project, breaking down the barriers was a key public health concept that we focused on. Barriers associated with growing a garden, especially for individuals who had never grown one before or who had limited space. The task can seem overwhelming. My team and I worked to ensure we addressed those barriers by creating blueprints that someone living in an apartment with only a balcony could even recreate. The third skill is communication. Communication is an aspect that is used in daily life. From our relationships to our jobs, communications can make or break the success of an interprofessional team. Being able to effectively communicate to others of different backgrounds and differences of opinions is one thing, but also being able to listen and understand what is being communicated to you is the other part of that equation. You can relay how and why you feel something should be done a certain way, but if the team you're a part of is not willing to be receptive to your communication, or even doesn't understand your communication methods, regression can take place, leading to frustration. Communication in my project was something I had to make special considerations due to the remote nature of our team collaboration. Ensuring that we use the visual exchange of information through emails, in addition to the audio component of communication, was key to ensure all individuals and communication styles were taken into consideration. So remember, the next time you are working as part of a team, make sure to display your knowledge related to public health. You are receptive to others' needs, whether that's your target population or your team members, and that you can effectively communicate your needs and others' needs. so that you can be a good and professional service member for public health.